guys, welcome to Nurse JBS Academy 19, and in this video I'm going to do a pharmacology NCLEX-RN review, and the drug of choice would be Raloxifene, Raloxifene. So this is one of the drugs that I have encountered when I took the NCLEX-RN. It's not as common as like heparin, warfarin, insulin, beta blockers, but you could encounter this drug around 50 to 60% possibility. So let's jump right in. What is Raloxifene? So by the way guys, Raloxifene is the generic name and the common brand name is Evista. During your NCLEX-RN, NCSPN will be giving you the generic name and not the brand name, but it depends. So if it's Raloxifene, that's the generic name, and the common brand name is Evista. That's the picture on your screen. So what is Raloxifene? Raloxifene is a medication used to prevent and treat osteoporosis in post-menopausal women and those on glucocorticoids. It is also used to reduce the risk of breast cancer in those at high risk. It is taken by mouth, so meaning it is taken orally. It increases bone density and prevents fracture of the spine. Can be taken with or without food, usually once a day, and it should be taken at the same every day. So what drug class does Raloxifene belong? So Raloxifene belongs to the selective estrogen receptor modulators, or SERMs. This drug class are used for various estrogen-related diseases and act on the estrogen receptor. So a very important information about this drug, guys, is that Raloxifene may increase risk of developing a blood clot in the legs, eyes, and lungs of a person taking it. So that's why healthcare providers really need to assess patients who are having venous thromboembolic events like deep vein thrombosis, pulmonary embolism, retinal vein thrombosis, and so much more. They are not given Raloxifene because it increases the risk of developing a blood clot. So just remember that. Raloxifene increases the development of a blood clot. So who are contraindicated in taking this drug? Number one, lactating women. Number two, women who are or may be pregnant. This drug is teratogenic, meaning it causes developmental abnormalities and it causes birth defects. Another thing that I've already discussed, women with active or past history of venous thromboembolic events, including deep vein thrombosis, pulmonary embolism, and retinal vein thrombosis, because this drug causes or increases the risk of developing a blood clot. And what are the side effects of this drug? The number one most common side effect, and you need to remember this, is hot flashes. Hot flashes is the most common side effect in the first 6 months of Raloxifene therapy. Very important to remember, hot flashes is the most common side effect in the first 6 months of Raloxifene therapy. The patient taking this drug also will experience leg cramps, swelling of the hands, feet, ankles, or edema, joint pain, sweating, and difficulty falling asleep or staying asleep. So when I encountered this drug on my NCLEX-RN, I was asked, what is the side effect of Raloxifene? And as I've said a while ago, the correct answer is hot flashes. So when I took the test, I wasn't sure about my answer. I didn't know this drug. I didn't know Raloxifene. I don't have any idea about it. So I had 50-50 with headache or hot flashes, but then I chose hot flashes. And then when I came home, I researched, I think I got it correctly. So if you encounter this one, the most common side effect of raloxifene is hot flashes. Okay, guys, thank you so much, and I hope you enjoyed this video, and thank you for watching all of my videos. Have a great day.